Oklahoma health professionals are preparing for measles to hit the Sooner State. While outbreaks have been reported in other states, the best defense is get vaccinated.
Oklahoma has yet to have a reported case of measles so far in 2019, even as it has surfaced in other states. Officials are trying to get ready before it hits. According to the Centers for Disease Control, last year, the United States experienced 17 measles outbreaks affecting hundreds of people across the country. So far in 2019, there have been more than 700 cases reported. That's the most since all of 2014, which reported a total of 667 cases. It means that despite measles being virtually eliminated in the U.S. just under 20 years ago, it's found a way back.
If you have the introduction of a case, usually that might be from somebody traveling, possibly even internationally, to another country where they're experiencing an epidemic of measles, and then coming back here after being exposed, developing illness, and then exposing others within their community.
Officials are suggesting adults and children who have yet to be vaccinated for measles should certainly do so soon.
Look into your vaccination history and see if you are adequately protected against measles. The general recommendation is that children at the age of 12 to 15 months of age are recommended to receive their first dose of measles, mumps, rubella vaccine, which includes the measles component, and then a second dose at 4 to 6 years of age.
As the news spreads about measles outbreaks in other states, doctors in Oklahoma are hearing concerns from their patients.
They are very concerned and have been calling, making sure that they're appropriately protected. Those that have children, those that don't, those that are particularly traveling overseas or out of the country.
There are classic signs to look for if you suspect you or your loved one might have the contagious disease.
The classic sign is a rash, little red spots all over the body, but that's usually not the first symptom. The first symptom is a fever and a runny nose, and then and body aches, and then you get a rash.
If a person suspects measles, they should call ahead before going to the doctor's office, clinic, or the hospital.
And if you can, advise patients who have a fever and a rash not to come to the office. Because again, why measles is such a big deal is that it's exceedingly contagious.
It is the very nature of measles' ability to spread quickly, which has health officials taking precautions.
We can be in this room, and if somebody had been in the room 3 hours ago with measles and left, and we come into that room 3 hours later, and we don't touch anything other than just breathe the air, we can get it if we're not immunized.
While Oklahoma has yet to report a measles case this year, it did surface last year.
Last year we had 3 cases, and I'm not going to say that's an outbreak because I think there were 3 isolated cases. They weren't related to each other. This year we haven't had any so far. I hope that stays that way.
Dr. Irvin Yin is a former state senator who worked on trying to raise the rates of vaccination in Oklahoma. He continues to work toward that goal now that he's a private citizen once again.
I'm talking to the state health department, seeing if there's some things they can do non-legislatively that could increase vaccinations. One is to just educate the public.
He expects measles to find its way to our state because our rate of vaccination isn't high enough.
And the experts, the scientists, the physicians who know, say for herd immunity, you really need about 95%, okay? And I can guarantee you we don't have herd immunity.
The state health department confirms Oklahoma's vaccination rate is below the national average.
When you look at young children, for example, from previous kindergarten surveys, for example, from prior years, we're sitting a little over 90%, adequate vaccination against measles for kindergarten-age children. Certainly there's room for improvement.
Yin believes the rise of misinformation has led to declining vaccination rates. The pushback on vaccinations is rooted in a faulty study linking them to autism, which has been debunked several times over the years. However, the misinformation has already taken hold on the internet.
It's partly the internet, I think, and social media, okay? If you Google vaccines, you can find all kinds of negative, nasty things about vaccines. In fact, you'll probably find more than are good, but they're not from reliable scientific medical sources.
The public can be assured that after decades of use, vaccinations are safe overall.
Not 100%, okay? If you talk to any scientist or doctor who knows, they will tell you that the chance of a serious reaction to a vaccine is on the order of 1 to 2 per million doses.
If a doctor sees signs of measles in a patient, the state health department will be immediately notified.
Which means that if a person were to present to a physician with symptoms that are suggestive of measles and a provider suspects that, they'll notify our state health department immediately so we can initiate investigation.
For anyone not sure about their vaccinations, a doctor can help find records. Healthcare officials also advise, even if someone believes they might have been vaccinated but want to make sure, another dose won't hurt.